Hello, I'm Joan Justice with HealthWorks Collective, and I have with me today Nadi Kaonga, a recent graduate of the Bloomberg School of Public Health at Johns Hopkins University. Nadi recently received an MHS degree in the International Health Department's Global Disease Epidemiology and Control Program at the Bloomberg School at Johns Hopkins. And she's been working on the Millennium Villages Project and has conducted some very interesting research using social networking analysis methods at the site in Bonsaso, Ghana. Nadi, why don't you tell us a little bit about the Millennium Villages Project in general, and then a bit about your work there doing the social network analysis?
Sure. So the Millennium Villages Project is taking place across 14 sites in 10 sub-Saharan African countries where they're looking at different ways that they can bring communities to empower themselves through various initiatives. And so the team that I've been working on was focused on health initiatives within across all of the mobile Millennium Villages sites, and we were focused on mobile health initiatives and sort of setting up an electronic health architecture across these various sites. But then in particular, for the piece that I was interested in was in the particular site of Bonsaso, Ghana, they had set up a mobile phone closed user group. And what a closed user group is we provided phones to the health team there, and that meant that they were able to speak with one another at no cost because they were all part of this closed use group. And we had worked very closely with the mobile network operator at that site to be able to set this up. And in particular, I was interested in, okay, what ways can we evaluate or assess, how useful has the closed user group been? How has it sort of changed the traditional flows of communication, which before were extremely, head of the chain, top down, hierarchical. And one way that we thought about this was, let's borrow from the social sciences social network analysis methods. And it's been used somewhat in public health research when looking at infectious diseases or communicable diseases like HIV/AIDS to sort of map out the transmission or different sexual networks, sort of following around infection or the spread of infection. And so we're like, okay, well, we're looking at an initiative that sort of is looking at the spread of information. So how can we sort of analyze this and also bring sort of these different conceptual ideas to how the network looks? And so social networking analysis methods lent itself very nicely to what we were interested in doing.
Cool. And what were the results that you found, Nadi?
Yeah, it was very interesting. So some of the results that we found was before, I was saying that the communication was very top down or bottom sort of moving up the chain, going high to the management of the health team in Bonsaso. So it's if the health team management needed to communicate with someone based in the community, they typically would have to go through, the managing their supervisors in between, and then that message would spread to the community based health staff. But what we were finding with the advent of, using the closed user group was people were establishing more direct communication channels. And so you'd find that community-based health workers were communicating directly with the management and vice versa, and sort of bypassing this sort of traditional communication structure. So that was a very interesting find.
So they were making more phone calls, and for what to ask? For information and to ask for advice maybe, and to be sure for what they were doing if it was correct. So that's a positive, right? They were asking for information. And
absolutely.
That's great. And these phone calls were free.
Yes, so the phone calls within the network were free, but people could place calls outside of the network to those who weren't within, the closed user group. But another interesting thing that we found, sort of when we were going through our analyses of not only the social network data, but we complemented it with interviews, so a qualitative component as well, was that people were really heavily using the phones personally, both within the network and outside of the network. So
Sure.
they were sort of establishing these personal connections with people, within their sort of working environment and outside of that. And in terms of the communications that they were having with work colleagues, besides the personal calls, they definitely were, like you had mentioned, they were seeking advice, they were coordinating with one another, they were better able to sort of engage with the emergency medical services that were within this rural community. Whereas before, I remember this one individual had mentioned, before we used to have to get someone to bike down to a whole different community where the ambulances were staged. And so that person would have to bike down and say, hey, we need the ambulance.
Yeah.
And then, then the ambulance would come. But now they're able to call directly and say, hey, I need you at, this particular site or at this particular location. So it's definitely improving some work efficiencies around that. And that was cited as some of the benefits around that. In addition to, I remember also a community health worker expressing like how she feels more empowered because for some health condition, she was able to communicate directly with, I believe it was one of the members of the health team management because her immediate supervisor wasn't sure of what to do. And so she took that as a learning opportunity after speaking with the health team management and getting this advice on how to take care of the case, that she was like, oh, now, like I'm able to address that issue because I learned it. And, the community, they think I'm like much smarter than I was before. So
That's great. Much more open, freer lines of communication so people can learn more, be more efficient, and all that. And you're writing this up, Nadi. Now, your paper has been accepted in which journal?
The Journal of Medical Internet Research.
Okay, and that will be coming out then in the next month or so?
Yes, that's what we hope for.
Okay. Well, that's just great. And congratulations on the study. And thank you so much for this. It's been really interesting to learn about the program and the social networking analysis. Thank you so much for joining us.
Thank you so much for having me, and it's been a pleasure getting to chat with you, especially about some of the research work that we're doing.
Thanks.
I appreciate it.